I'm a consultant toxicologist in Kiambu County, and I'm also the chairman of KMPDU in Central Region, Kenya. And we are here because the doctors of Kiambu are not happy of the way they are being treated by their employer. We have 10 grievances that we want addressed, and that is the reason we are giving a 21 days notice to enable us and the county, if the county is interested, sit down and solve these issues. Beyond which, on midnight of 26th of the month of May, we shall stop working. All doctors will stop working in the whole county. This includes consultants, the general doctors, who are either pharmacists, dentists, or MOs, and even the interns. Therefore, no single doctor will be found in any hospital in Kiambu. And therefore, we are telling our patients on 27th of the month, they should not go to any of the hospitals in Kiambu seeking the services of a doctor, because the doctors who love them, who have always worked for them, will not be able to sit and listen to their illnesses and get the solutions as we have done. We are sad because we love our patients. We also love our government, and especially the government of Kiambu, because we work with the government of the day. And therefore we are urging our governor, whom we love so much. We have seen his development record in other areas, but we also want these development records to be seen clearly in the health sector as well. We want to believe that probably the information that is fed with could be wrong, because despite the number of meetings that we have had with his teams, we are not getting a way forward. Doctors were on a strike for 56 days, and after that strike, there was a return to work formula that was done. Every county in the country was supposed to implement issues that were specific to those counties. The most important issue for Kiambu County was that one of increasing the number of doctors, because Kiambu has an acute shortage of doctors. We have lost 2 interns as a result of that. We have lost a number of doctors to illnesses that are related to their mental status, which are coming as a result of the workload and burnouts. For that reason, we feel that since the county has decided not to talk to us, not to obey any laws of the land, that we must force them to come on the table. We have gone to court. Court sent us to labor reconciliators. Kiambu County did not appear at all, and therefore they ignored the court, because they ignored the return to work formula. They ignored a court ruling that sent us to conciliator, and all the letters that were written to them, they have not responded. For that reason, it means that in as much as we are peace-loving Kenyans, peace-loving doctors that want to be their patients, that wants to see good outcomes in Kiambu, we have no other alternative than to down our tools come 26th day of this month of May. Our first meeting with the governor promised that he will be paying salaries on the 2nd of every month. The salary for the month of March was paid on 28th and 29th of April. So you can see it's a following month, when he's supposed to be paying the salary for April, he's paying the salary for March. As a result of that, those who seek their services under Sha, and we all know that all Kenyans are supposed to seek their services under Sha, were not able to access health care from 9th. And we have a good number of doctors that have illnesses that require to be covered. So you can imagine a doctor who is expected to be seeing another patient when they themselves are not even sure how they are going to be treated, their own illnesses, and also their families. So we are sad because of that, and that one is resulting from the delayed salaries, because when they delay the salary, this is also when they delay deducting and remitting money to Sha. We doctors are also very sad because they have not been promoted, despite that return to work agreement was that all doctors be promoted. So we have 197 doctors of Kiambu that are crying for their promotions. They have not been promoted. Because of the sadness of the low number of doctors that have been hired, a hospital like Thika 5, which used to have 17 MOs, medical officers, handling their patients, are crying with only 2 MOs doing the work that used to be done by 17. So you can imagine the burnout in those 2 doctors. As a result, in areas like Matanet, the county has started forcing consultants to start doing duties that they are not expected to do as per Kenya Medical Practitioners and Dentists Council, and a document we call scheme of service, which spells exactly which doctor is supposed to be doing what at what level. What does that one mean? That one means that the county is getting retarded, because you cannot train a consultant who needs even to be super specialized. You cannot bring them down to do what they used to do when they had not gone back to school. And therefore, in as much as we want to stop our Kenyans from going to India and other countries, we are not doing enough. We are spending taxpayers' money to take people to school, only to come back and fail to enable them to do what they are trained to do. As a result, people even end up forgetting what they were trained in. To avoid this, because doctors are clever people, they are resigning. So we are losing doctors every day, resigning to go to work in other counties or other sectors, simply because the Kiambu County Government is not enabling them to do what they were trained in.
And the secretary of the KMPDU Central Branch. And today we are here to give a strike notice to the county government of Kiambu that will essentially lapse within the next 21 days. And this is because of several issues. First and foremost one would be chronic salary delays that constantly come late, and also delays in remittances. Crucially, remittances such as Sha, which means most doctors in the county government, working for the county government of Kiambu, do not have medical insurance for many days within a month, as they're waiting for the remittances to be made. The other issue we have a big problem with Kiambu about is understaffing and not employing doctors. For instance, if you look at 2 hospitals of comparative size in terms of output, Pumwani Hospital has around 80 doctors working in their maternity department. Pumwani delivers 9,000, does 10,000 deliveries in a year. If you compare it with Thika level 5, which does roughly around 7,000 deliveries, you only find a hospital like Thika has only 8 doctors working in its maternity. So you can see we're talking about almost 10 times worse of a hospital of comparative size. So basically we're here to just tell the county government of Kiambu, to tell the people of Kiambu, and to tell the Kenyans at large that effective 26th May at midnight, the doctors of Kiambu will regrettably have to down their tools if the county government of Kiambu does not address the issues that we have outlined in our strike notice. We have engaged with the county government in multiple channels, fora, and unfortunately the county government of Kiambu is very obstinate. It refuses to listen. We are a union that does not like to have to go on strike. We work very well with other county governments, but the county of government uniquely since 2022 has really deteriorated the good working relationship doctors had with the administration, where we would severally have meetings, continuous dialogue, having correspondence with them in writing. However, the current administration seems to not want to pursue such a path of solving such issues. So that's why we've, as doctors collectively in Kiambu, resolved that we might have to go on strike, and that's why we're issuing this strike notice. So what happens with Sha? If you do not remit workers' premiums on the 9th of the month, their cover lapses. What happens with Kiambu County, they always delay those remittances to around 20th, 25th of that month. So essentially, if you work for county government of Kiambu, you're only covered between 25th and 9th of the next month. For a group of workers who work and are exposed to illnesses, that is one of the most horrific things you can tell them, that they cannot even afford their own service they provide. For salaries, every month, salaries do not even come by 5th of that month. They come, like the last month salary came towards 25th of the month. So every month it's at a different date, but it's always within the 3rd or the 4th week of the next month.